Hi everyone, my name is Laura Eatmon and I am the Lung Health Nurse Navigator at Advent Health Ocala. And today myself and Gloria Bailey will be talking to you about lung health. I will be talking to you about the importance of lung cancer screening and a little bit about lung cancer prevention. And Gloria will be talking about COPD, lung health, vaping, and smoking cessation. We're going to go ahead and start with my presentation on lung cancer prevention and lung cancer screening. All right, first I'm going to show you a quick video about lung cancer screening.
We are sharing important health news with you. Just like with mammography for breast cancer screening and colonoscopy for colon cancer screening, a new test has been approved that can find and detect lung cancer, which is the leading cause of cancer death worldwide for both men and women. Research shows that screening the right people can save lives. Screening can find lung cancer at a much earlier, treatable, and curable stage. Lung cancer found in its earliest stage can have up to a 90% chance of cure. Because of your age and smoking history, you are at higher risk of getting lung cancer and qualify for this screening test. The good news is this screening test for lung cancer is quick and painless. It requires no needles or dye. Typically, your clothing can be left in place, and there's no need to limit eating or drinking prior to the test. Lung cancer screening takes about 10 minutes, and the actual scan only takes a few seconds. Here's how it works. A machine called a CT scanner takes 3D X-ray pictures of your lungs using a small amount of radiation, also called low-dose CT. This level of radiation is more than a chest X-ray, but is much lower than other types of CT scans. Currently, this screening test is the only one that can find lung cancer early, which allows for more treatment options to save lives. As with all cancer screening, this test is not perfect. Some cancers may still be missed. Some scans may show spots in the lung that look suspicious, but may not be cancerous. These are called false positives. Similar to moles on the skin, your lungs may have nodules or spots that are watched, but are normal or non-cancerous. When needed, your doctor may recommend additional testing to determine if you have cancer. Lung cancer can be aggressive and advance quickly between stages. This is why it is important to be tested annually until you are out of the recommended age range or for as long as your doctor recommends. Regular screenings will let your doctor see if spots in your lungs are stable or whether any changes over time may be more suspicious for cancer. Screening for lung cancer before symptoms appear is important. Without it, most people don't see signs of the disease until it has spread to other areas of the body, making it harder to treat. If you have other health conditions that increase your risk of lung cancer, such as diagnosis of COPD, a family history of lung cancer, or job exposure to cancer-causing agents like radon and asbestos, tell your doctor and find out if a low-dose CT scan is right for you. Lung cancer screening with a low-dose CT scan is recommended by leading advocacy, government, and medical groups, including the GO2 Foundation for Lung Cancer, federal government agencies, the National Comprehensive Cancer Network, and the American Cancer Society. For individuals who meet the high-risk criteria, low-dose CT screening for lung cancer is covered annually by Medicare and most private insurance plans at 100% with no out-of-pocket cost, just like mammograms and other screening tests. However, additional testing and follow-up scans between screenings may have a cost, such as a copay or deductible. Ask your doctor if your insurance covers the test. If you smoke, it's still important to consider quitting. You might think it doesn't matter, but there are many benefits to quitting. Your healthcare team can provide resources to help you. Don't be afraid to ask your doctor or call 1-800-QUIT-NOW for support. Don't wait. Talk to your doctor about low-dose CT lung cancer screening and if it's right for you. It could save your life. possible by Go-To Foundation for Lung Cancer, with support from Hilary Deskins, Michael Geiske, Mary Pasquinelli, and Douglas Wood.
Alrighty, so a computed tomography, a CT scan, creates a two-dimensional cross-sectional image of your body, which is then displayed on a monitor called a spiral CT. So a low-dose CT of the chest that the video mentioned produces axial and coronal slices that total approximately 300 images. A chest X-ray is a projected image of the chest and can produce either one or two images. The low-dose CT axial and coronal slices are 1.5 millimeters thick and are able to detect lung nodules smaller than 5 millimeters, which are likely missed on a chest X-ray, which is why the low-dose CT of the chest is more accurate than the chest X-ray. All right, so lung cancer is the leading cause of all cancer deaths. Lung cancer kills more people than breast, prostate, colorectal, and brain cancers combined. Lung cancer claims the lives of more than 156,000 people each year. In 2019, an estimated 228,000 men and women were diagnosed with lung cancer. Lung cancer is typically diagnosed after symptoms have developed, and symptoms typically develop after lung cancer has progressed to stage 3 and stage 4. So according to the 2019 health data survey, lung cancer is the number 2 most commonly diagnosed cancer in Marion County, followed by breast cancer. However, the lung cancer incidence rate decreased from 2007 to 2016 by almost 3% per year in men and 1.5% per year in women. So lung cancer is the number 1 cause of lung cancer death from 2012 to 2016 in Marion County. Now, the lung cancer death rate has declined by 51% since 1990 in men and by 26% since 2002 in women due to reductions in smoking. The mortality rate has decreased by 4% per year in men and 3% per year in women, which is incredible. So why is lung cancer screening so important? More than 8 million Americans qualify as being high risk for lung cancer, and they are recommended to receive annual screening with a low-dose CT of the chest. However, typically only 3% of those eligible for lung cancer screening actually get screened. Based on the large U.S. clinical trial, screening with low-dose spiral computed tomography, low-dose CT, reduced lung cancer mortality by about 20% compared to standard chest X-rays among current or former heavy smokers. If half of the high-risk individuals were screened, over 12,000 lung cancer deaths each year could be prevented. So here are a few statistics from 2020. So the cancer death rate in the United States fell 2.2% from 2016 to 2017. And since 1991, the cancer death rate has dropped 29%, which translates to approximately 2.9 million fewer cancer deaths than would have occurred if the mortality rate had remained constant. Experts have attributed the decline to reducing smoking rates, improvements in early detection, and advances in lung cancer treatment. Due to the lag between exposure and cancer diagnosis, people who stop smoking may develop lung cancer later, but these rates should continue to decrease. Now, in the last decade, several important advances in diagnosing and treating lung cancer have also helped avert patient deaths. Now, this is the largest single-year decline in cancer mortality that has been ever reported. Now, back in the day, a diagnosis of lung cancer used to be a death sentence, and now people with lung cancer are living longer than they ever have before. New imaging technologies have allowed doctors to accurately assess the stage of the cancer and its prognosis. Less invasive surgical approaches have sped up the recovery times. And in addition, since 2015, immunotherapy has helped patients by enlisting their T cells to kill their cancer tumors. Now, survival. The 5-year relative survival rate for lung cancer is 19% overall, 16% for men and 23% for women. Now, there are many different types of lung cancers. The most common type of lung cancer is non-small cell lung cancer, which is what you see abbreviated as the NSCLC. Now, the non-small cell lung cancer survival rate is 24%. Small cell lung cancer survival rate is 6%. Small cell lung cancer is more aggressive than non-small cell, and it is more rapid growing. And only 16% of the lung cancers are diagnosed at a localized stage, for which the 5-year survival rate is 57%. So, am I eligible for lung cancer screening? Now, there are a few requirements in order to be considered eligible for lung cancer screening. Between the ages of 55 and 74, smoked a pack a day for 30 years or smoked 2 packs a day for 15 years, which either scenario equivalents to the 30 pack years, and quitting smoking less than 15 years ago or current smoking. And these are CMS guidelines. So, smoking. 80% of lung cancer deaths in the United States are caused by smoking. Smoking increases with both quantity and the duration of smoking. The risk does. Now, cigar and pipe smoking also increases the risk. Exposure to radon gas is the second leading cause of lung cancer in the United States. Other risk factors can include exposure to secondhand smoke, asbestos, which is particularly among the smokers, certain metals, chromium, cadmium, arsenic, some organic chemicals, radiation, air pollution, and diesel exhaust. Now, radon gas is released from soil and can accumulate in indoor air. Specific occupation exposures that increase radon gas exposure risk include rubber manufacturing, paving, roofing, painting, and chimney sweeping. So Advent Health Ocala is partnered with Radiology Associates of Ocala, and in April 2019, we were named a Screening Center of Excellence for Lung Cancer Screening by the GO2 Foundation for Lung Cancer. A Medical Imaging Center of Ocala and Timber Ridge Imaging Center are 2 of Radiology Associates imaging facilities, and these facilities are designated lung cancer screening centers by the American College of Radiology. And the first facility is the Medical Imaging Center of Ocala, and the second facility is the Timber Ridge Imaging Center as well. So in order to be designated a lung cancer screening center of excellence by the GO2 Foundation, we have to meet several different standards. We have to comply with the standards based on best practices. We also work closely with a lung cancer multidisciplinary clinical team, and we refer those still smoking to a smoking cessation program, report the results to a ordering physician within a timely manner. All right, so how do I get screened for lung cancer? So the lung cancer screen is a low-dose CT of the chest, and it is more beneficial to receive the low-dose CT than it is the chest X-ray. Now, when a low-dose CT screen is done, it is scored with the scoring called LungRADS scoring system. depending on the nodule size, the location of the nodules, and characteristics of the nodule, and how many nodules there are. Now, all lung-RADS patients that score a 4 or greater are presented to the multidisciplinary cancer care conference for review and recommendations for the next step. So our low-dose CT program started December 1st, 2016, and we have screened over 700 patients since then. Low-dose CTs reduce lung cancer mortality by 20% compared to standard chest x-rays among current or former heavy smokers. The low-dose CT uses 90% less conventional radiation than a standard CT chest. So recommendations after a low-dose CT. So these are a few recommendations from the radiologist reading the report after a low-dose CT test has been done. First is smoking counseling. Second one is follow-up low-dose CT chest. That could be within a year, that could be in a couple of months. It just depends. The next is a PET CT, and the PET CT would evaluate to see if the nodule lights up on the PET CT, and if that lights up, that is suspicious for malignancy. The next is CT guided needle biopsy or bronchoscopy, depending on where the nodule is located. Either one might be better to biopsy it. Surgical consultation for a cardiothoracic surgeon to remove the nodule, and no follow-up needed. Benign nodule, no follow-up is needed. And this is a link that shows all of the accredited facilities that do have the lung cancer screening within our community. There are 6 of them, and this is a link to each of those facilities. Thank you very much, everyone, for coming today, and thank you so much for allowing me to present for a little bit about lung cancer screening and lung cancer prevention. It's very near and dear to my heart, so please cherish every breath, start your journey to whole health, and please schedule your lung cancer screening today. Thank you.
Hi, my name is Gloria Bailey. I'm a respiratory therapist over at Advent Health. I'm also the Lung Health Program Coordinator, and today I'm going to be doing a presentation on focusing on lung health. Okay, so we're going to start with how your lungs work. Our lungs are a very, very big organ, and a function is very necessity for life. Our lungs make the oxygen available to our entire body. When we breathe in our air travels all the way through our lungs, goes to our alveoli, and it's picked up by blood that's pumped to your heart, and from your heart it's pushed out to all the different tissue and organs and cells in your entire body to give them what they need for survival. In that process, the carbon dioxide, which is the waste product, is put back into that blood and into the cells and brought back into your lungs, and then we exhale. So we're inhaling our good air and we're exhaling our bad air. Part of that respiratory whole system is our nose hairs. They trap a lot of the particles when we breathe in that our body doesn't need. So it kind of acts as our air cleaning system filter. But we also have cilia in our airways that act the same way. They're microscopic, they're very tiny, and they're all throughout your entire lung system. What they do is they help sweep up all the foreign particles that we don't want, and they help sweep up along with the mucus that we make in there to give a little bit of smoothness inside our lungs, and everything works together in making sure it filters our lungs so it doesn't get to our alveoli and clog up that part. So what can we do to promote healthy lungs? Of course, we don't want to smoke. And if you do smoke, the best thing that you can do for yourself is to quit. It's never too late to quit. Smoking is the major cause of lung cancer and chronic obstructive pulmonary disease, which a lot of people call COPD. Another thing is you want to avoid exposure to indoor pollutants, radon. There's ways of testing your home for radon, and secondhand smoke, and that's allowing anybody else to come into your home and smoking. You want to avoid crowds during the cold and flu season, and now with COVID, you want to just make sure that you stay indoors as much as you can. You just want to make sure that you aren't exposing yourself unnecessarily. You want to prevent infection, wash your hands, oral hygiene, get your vaccines, your flu and pneumonia. Flu is yearly, pneumonia can be, from 5 to 10 years, and get regular health care. So this is really important when you need to have that good rapport with your physician. You want to keep on going in for preventative and maintenance of yourself. Even when you feel like you feel great, this is still a good time to keep those visits going, because you want to make sure that you catch anything that might be coming on early. We may feel great, but there could be some underlying things that we're doing that we don't necessarily see at the time. And that's part of their job. They're taking chest x-rays, they're doing regular lung screenings when needed. They're taking your blood, making sure that everything looks good. So if there's anything that's detected, you can take care of that early enough. Another thing is exercise. Exercise is immensely great for your mental health as well as your physical health. So keeping that cardiopulmonary system active and going and healthy is a very, very big part of lung health. And, of course, mental health, exercise is also very great for. So managing COPD. So if you have been diagnosed with COPD, there are usually two main components to it, which is emphysema and chronic bronchitis. Emphysema affects those alveoli that are at the very end of all your bronchial tubes. It's like a little bowl of the little tiny bubbles at the very end, and that's where that oxygen gas exchange happens. They are called alveoli, and when they become damaged, and they can become destroyed from tobacco use, from all those chemicals that we're breathing in, can thin those linings and make it hard for the oxygen to pass over into those blood vessels. Now, chronic bronchitis affects the bronchial tubes. They become inflamed, narrow, the mucus clogs up the airways, which makes them very restrictive. It makes for oxygen hard to get by there. It makes the air hard to get past there. And it also kind of clogs it up, making you cough more, you're more congested. And there are some great medications that can help also with managing the COPD, which we'll touch into that also. So managing COPD, we always want to make sure that we know what it is. So COPD is a lung disease that involves the lung airways, air sacs, or both. Like I said, with chronic bronchitis, it affects those airways with inflammation and mucus production. And the emphysema usually affects those, the alveoli, down right where that gas exchange happens. COPD is the third leading cause of death worldwide. There is no cure that cannot be reversed, but there are a lot of things that we can do to manage them and to improve the quality of life by being able to manage them in a good way with different techniques, with medications, with staying away from pollutants and irritants. There's a lot of things that we can do to manage that airway disease a lot better. The importance of taking medication. It is not just taking a medication. You need to know what you're taking, how you're taking it, why you're taking it, and when to take it. So there's a lot of different types of medications when it comes to airway disease. So it could be a passive nebulizer, it could be an MDI, meter dose inhaler, it could be dry powder. You just need to know, is it a short acting? Is it something that's like a rescue inhaler? Is it a maintenance drug? Is it something that we may not notice those quick effects from, but it is helping us in the background? And then you also need to know how to take it. If you aren't taking it properly, then you aren't going to get the full dose that's needed to help open up those airways. So you just need to make sure that when you take it, you're taking it exactly how it's prescribed and know how to take it so you're actually taking it correctly. A misconception and a misuse of meter dose inhalers is if it's, if it's prescribed 2 puffs. I have seen people take those 2 puffs like right in a row. Well, you aren't giving the first puff enough time to even get into the lungs to work before that second puff is given. So you're supposed to wait, 2 to 3 minutes in between puffs to make sure that that first puff is getting in there and that medication's getting into working. And it also helps with the recoil on the meter dose inhaler to recoil back to its natural position to be able to give you that full dose again. So it's really important that we learn how to take the medication properly. Using oxygen is a prescription drug and it should be followed as it's prescribed. It usually ranges from 1 to 6 liters for home use. So when the physician orders a certain liter flow, there's usually a reason why it's 1, 2, 3, 4, or 5. A lot of people will take it upon themselves to move that, adjusting it according to their shortness of breath, but the shortness of breath always doesn't equal the desaturation in their oxygen levels. Sometimes it's just overuse of some muscles, or you walked a little bit too far and you just need to stop, relax, and do some breathing exercises, which we'll be going over also. So for oxygen safety, you definitely no smoking in the house, no smoking with it on. It's better if you're not smoking at all, but definitely no smoking around the oxygen, no candles or anything that can start a fire. And you always want to make sure that you have a backup tank for power outages. So if your power goes out and you happen to have a concentrator, which is an oxygen device, if the power goes out, that no longer works. You want to make sure that you have some type of oxygen source that you're going to be able to use without having to have that power. And that'll also give you enough time to contact the home care company or the electric company, or to see what's going on to get that power back on, or to get some extra oxygen tanks delivered to you. Traveling with oxygen, especially like if you're going to be traveling over, having to get on a plane, if you contact your home care provider, they can prescribe you with or they can give you the instructions on how to contact the travel company and get that oxygen on the plane and wherever you're going to be landing, to make sure that you have that oxygen during your travel and wherever you're going. So that's really important to keep in contact with them. Here at Advent Health, I do a Better Breathers Club. It is through the American Lung Association, and it's a support group that's offered to educate on managing respiratory conditions such as COPD, asthma, cancer, pulmonary fibrosis. It is a class that we've been doing monthly. Because of COVID right now, we've been doing virtually, but we will, in the future, be doing it in person again. It's a great support group. The group kind of runs itself, and we kind of just go based off of what the needs are of the group. Do we want to learn about medications, oxygen, nutrition, exercise, sleep? We bring in different speakers from different places. It could be a pulmonologist, it could be a nurse, it could be a respiratory therapist. So we have a lot of resources with a lot of great information that could be useful to manage the COPD. So managing COPD, 2 great resources that you can always use, learn, and you can carry with you all the time are pursed lip breathing and diaphragmatic breathing. Pursed lip breathing, it kind of helps manage your respiratory rate. So you can tend to overexert yourself we're going to use an example of you need to go to the mailbox, and the mailbox is 50 feet away, but you're afraid that you're not going to be able to get there because it's just going to expend too much energy, and you're going to get short of breath trying to get there. So pursed lip breathing helps control that ventilation and it helps expand your airways and get that bad air out so you can get that good air in, and it just controls your respiratory rate all the way together. And it also is very, very calming. Pursed lip breathing is used more than just calming your respiratory rate down and overcoming shortness of breath. People all over the world use it. They use it to help calm them. It's very relaxing. You can use it at any time, and it's just, it really brings your breathing back together. So pursed lip breathing is, you always want to relax your upper part of your body, all those accessory muscles, your neck muscles, your chest muscles, your back muscles. When you get short of breath, you tend to pull in all those muscles because you're trying to gasp for that air. Well, you're actually utilizing more oxygen trying to use all those extra muscles. So you always want to start with relaxing your neck and shoulders, and you want to inhale nice and slowly in through your nose. So you want to breathe in for a count of 2 or 3. If it's 2, you always want to exhale longer than, and twice as long as what you did inhale. So you want to breathe in 1, 2, and through pursed lips, not like you're trying to blow out a candle that's across the room, but nice and gently. You want to blow out just like it's one candle. You want to blow out for a count of 4. So you want to in through your nose, then nice and easy out through your mouth, okay? That's helping you relax your shoulders. It's controlling your respiratory rate, and it's helping with that shortness of breath, okay? Also with COPD, you tend to, breathe and gasp because you're always trying to catch that air. You don't let all that extra air that's in your lungs. It's called air trapping. People with emphysema can get it also from, they tend to hold on to too much air in their lungs and they don't get it all out. So they pretty much fill themselves up with air and they're not utilizing all their lungs. So pursed lip breathing really helps empty out your lungs so that next breath in, you can fill up all your lung and you can use all that space and you can help oxygenate better and you can control that respiratory rate and you can decrease your heart rate and you can kind of like bury that shortness of breath and you can start over again. So diaphragmatic breathing. This also helps control your breathing. So you inhale, and like I said, with the pursed lip breathing, you always want to relax those upper respiratory muscles and those accessory muscles that you're trying to use. So you want to use that bigger muscle, which is a big muscle that we use for breathing. It's at the base of our lungs. It's a big dome that sits on the base, and that helps with breathing in and breathing out. So as we breathe in, that diaphragm flattens and it helps our lungs get big so we can breathe in that air. And then we exhale, the diaphragm raises, but it's being pushed also by our abdomen. So it's giving you that extra push to push out all that extra air that we have in there. So when you bring in, your lungs can fill up again. So we do also not just call it diaphragmatic breathing, we call it belly breathing. So what you're trying to do is engage those abdomen muscles to help work that diaphragm. So the diaphragm over time, especially with COPD, we weaken that diaphragm because we're always using the shoulder muscles and the neck muscles and everything to breathe because we're so short of breath. Well, we're trying to retrain that diaphragm to use it because that's a bigger muscle. So bigger muscles use less oxygen, then they don't have to work as hard. So we want to engage that diaphragm by breathing in. You want to almost push your belly out. So when you push your belly out, it lets that diaphragm go lower to fill up our lungs. And then you want to kind of squeeze your belly to help push that diaphragm up to push the air out. And that'll help, along with pursed lip breathing, really fill up those lungs and get more oxygen and control that breathing and stop that shortness of breath. We tend to get in this little anxiety and panic cycle when we get a little short of breath. You tend to not concentrate on your breathing. You're just wanting to get that air. But if we sit there and we focus on that pursed lip breathing and that diaphragmatic breathing, we control our breathing, we lower our heart rate, and we get our breath back. So tripod breathing, it's not exactly a breathing technique. It's more like a breathing posture that that people take when they do get short of breath. So a lot of people who get very, very short of breath, who they can't pull in that air, they tend to lean forward. So leaning forward actually will drop your abdomen out of the way for that diaphragm to also drop. And then it opens up the back of the lungs for a little bit more surface area to get in a little bit more oxygen. And then it also, with that leaning forward and you're like bracing yourself either on your knees, some people do like lean up against a wall. It's also taking that extra pressure off your shoulder and your neck so you can use more of your diaphragm and relax your neck muscles a little bit more. It tends to help people. It always doesn't get them out of that shortness of breath. That pursed breathing and diaphragmatic breathing really are those two that using those combined really can pull you out of that panic and getting short of breath. Now, of course, you can always push yourself past that, and there's some other physiological things that might be going on while you're so short of breath. But for the most part, it's usually because we've overexerted. We walk 2 more feet than what we should have. A good tip on that one is, hey, if the mailbox is 50 feet away, put yourself a chair in between the door and the mailbox so you can take a break in between and not overexert yourself just to go get the mail or whatever task that you're trying to do. So here's some respiratory medications. There's all different ways. A lot of people who already have COPD or asthma or pulmonary fibrosis are a little bit familiar with some of these different devices. There's the breathing treatments. There's all different kind of inhalers. There's discus. There's some are, pills. There's a couple of injections that are out there for asthma. So there's just, this is just kind of showing you there's all different kinds. There's short acting, there's inhaled corticosteroids, there's combination medications that are preventative, medications along with the inhaled corticosteroids. So there's just a lot of different ones that are out there. Just knowing them and knowing how to take them when you do have them is a very, very big step. But always get with your physician. Your pharmacist should be able to also guide and help you with how to take those appropriately. And tobacco cessation. So why should I quit smoking? So there's a lot of health risks with smoking. And like I said, the best thing is not to smoke, but if you do smoke, the best thing you can do for yourself today would be to quit smoking. The health risks of smoking, it's the leading cause of cancer in the United States and increases the risk of many other types of cancer. So it's not just lung cancer that you can get from smoking. There's pancreatic cancer, there's bladder cancer. You just have to know it doesn't just affect your lungs. When you smoke, it goes into your alveoli, and remember, it jumps on those blood vessels and it goes to your heart, and your heart pumps it out to every single cell and organ and all your tissues in your body. So you're kind of affecting a lot of different systems other than just your lungs, even though your lungs are a very, very big organ and very, very important. So benefits of quitting. The benefits that you get from quitting happen immediately. So especially if you walk away from the place that you're smoking, you get fresher air and you're not surrounding other people with the secondhand smoke. That also is bad. So recovery starts in about 20 minutes. After about 20 minutes, your heart rate drops and your blood pressure drops, because 2 of the symptoms of smoking is increased heart rate and increased blood pressure. So our bodies are always trying to go back to homeostasis, which is always trying to normalize. So, after 20 minutes, your heart rate comes down and your blood pressure comes down. But then after a couple of hours, you're smoking another cigarette and another cigarette. It's very, very hard on your system. It's hard on your heart. It's hard on your lungs. It's hard on your arteries. It's just very difficult for your body to work against everything that you're doing. So after about 12 to 24 hours, the carbon monoxide levels also go away in your body. Now, of course, we might have a minute amount just from the environment that we're exposed to. But for people who smoke, those levels are a lot higher. And with that carbon monoxide, it really it impedes on us trying to get all the oxygen to all our cells to feed all our tissue and organs. So getting rid of the carbon monoxide is a great thing, and that's 12 to 24 hours after we quit smoking. After a few weeks, the shortness of breath starts to dissipate. Our lungs start getting a little bit more clear 1 to 3 months. And then for every month and every year after that, we just reduce our risk of stroke, of vascular disease, of cancers. So our risks go down to, they go down to a quarter, go down to a half, as if we were non-smokers. So definitely the sooner you quit, the more your body has to recover and to do some healing. So aids to quitting successfully. There's a lot of different tools out there. There are some prescription medications that can be used, but there's also some non-prescription medications that are used. Here at Advent Health, we do every month, we have a 2-hour tobacco quit group. We offer, it's education, it's a lot of tips on how to quit. We try and figure out what your barriers are. We try and get a plan for you on how you're going to be best successful at quitting. And we also offer free nicotine replacement, such as patches, gum, and lozenges, depending on how much you smoke and when you smoke and what you smoke. And those really aid in the success of quitting permanently. So that's a really great group that we have here at Advent Health. Okay, vaping. Vaping, it's new but not so new. So vaping and e-cigarettes are electronic devices. They heat up the liquid, and over probably about the last 10 years, this has become very popular, especially among the younger population. It is still harmful to our lungs. Does it have less chemicals than cigarette smoking? It does, but they still have very harsh chemicals in there that are destroying and causing destruction in our cells and our lung tissue. There is the EVALI. It's e-cigarette vaping acute lung injury that they found that started last year. And it's kind of on the downside of it, but they are still seeing cases of it. There were the 2,600, a little over that. I think they got up to 2,800. CDC is no longer actually tracking that. It's up to the states to track how many EVALI cases that there are, and that were people going in the hospital between being put on a ventilator, going into acute respiratory distress syndrome, and there were, I think we're at 82 deaths. So between EVALI and cigarettes, or the causes of cigarette smoking, they both have really huge risk factors. With e-cigarettes and vaping, it's still new, so there's still a lot of information coming in on the risk and the hazards of inhaling that aerosol. So the two main ingredients are propylene glycol and vegetable glycerin. Those are the two that are needed to deliver the nicotine. Nicotine is pretty much in all the e-cigarettes. So like I said, we're still learning more about vaping, but we do know that it is not FDA approved smoking cessation tool. I know a lot of people have used that as it, but it is not approved. There's just too many things that are still being evaluated and researched right now on that. This next slide is just going to be a few of the different things that how they deliver it. There's e-cigarettes, there's ends, there's ands, there's mods, there's vape pens, puff bars, hookah pens, Juuls, vapes. They have every kind of delivery device out there, and when one doesn't seem to be selling, I guess they come up with a new one. Puff bar is the newest one, and kids really love that because they're colorful. It's very inviting, as far as all the flavoring in it, which the flavoring isn't very good for our lungs either. So definitely some serious research happening on vaping today. So that does conclude the presentation on lung health. I really hope that you enjoyed that.